Good afternoon, ladies and gentlemen. This is Jeff Kerwin with Washington State Chiropractic Association. Thank you for joining us today. We've got Matt Childs with Sapper Insurance. He's going to talk with us about association health plans and potential programs that we can do through the WSCA for you. Matt, go ahead and take it from here.
Great, thanks so much. I'll turn on my video here. So hi all, thanks for joining today. Jeff and I were chatting over the last couple months here, and I think we have a cool program that would make sense for this group and others in the association. So that's the main intent here. I'm going to screen share to let's do a quick PowerPoint presentation here to chat about some health insurance trends. And so I'm going to be looking at another screen over here. But again, Matt Childs, Sapper Insurance, based in Washington. So I help Washington state businesses find benefits, and I try to demystify that in the insurance world for a health benefits standpoint. So happy to help and happy to answer questions if you have them throughout this presentation as well. But as we get started here, the main emphasis, there's two of them really, but the main emphasis of us getting together today is we can link businesses together, and I'll get into that in a minute. But what that really means is I can link the businesses that as part of the association. I'll bring them together. I'll get better rates and coverage, and then that way you can have just fantastic coverage and just kind of another layer of rate reduction as a result of that. So that's something unique that we'll chat about. The other thing I want to mention is I know there may be some individual practices here as well, and I can help one-person companies with group health insurance. And so again, this is part of that link grouping, and I can do it individually, but we'll get into that later as well. So those are kind of the main two highlights that we'll chat about. But wanted to just really quick set the stage and set context, and so you're aware of what's happening in the market right now. So if you have a broker, hopefully they're communicating this to you. If they're not, that's fine. You'll get in it here. So trends, what we're seeing. So we're seeing a lot of self-employment. We're seeing a lot of just people geographically going around the country and even internationally too. But just that disparate workforce is what the trend that we're seeing. We're seeing a lot of high utilization in virtual care, which is a good thing. It's not new, but it's something that's been around for a while, but it's now having a bigger emphasis in folks. And then increasing costs, we'll chat about that and what we're seeing in the market. And so just from an employee and employer standpoint, we're seeing this really seismic shift of folks that are getting side gigs. There's a couple studies out there, but this one in particular out of McKinsey, they just studied about 5-6 years ago, and they said, about 27% of people had some type of called a side gig, and they did that same study just recently, and they said it's up to 36%. So chances are your employees have some type of other revenue source. Okay. Neither good, bad, ugly. It is what it is. And so what we're seeing is folks are looking elsewhere for other revenue streams. And so just something to be aware of. One of the reasons why we see and know this is a graph of Washington State on the business formation side of things. And so the graph shows you how many formations, business formations, new entities are created in the state of Washington every year. So it goes on the left-hand side in 2004, and we're going to go to the right-hand side in 2000 to present. And you can see there's this drastic increase of business formations, coming out of that pandemic. Right. You can see the large dip in about April 2020, so that Q1, Q2 timeframe, people paused. But coming out of the pandemic, the vast number of new business formations is happening. It's a lot of 1 to 2 person companies. We're seeing a lot of it in retail. We're seeing a lot of it in professional services. We're seeing the marketer who wants to try to do something on their own. We're seeing somebody who wants to sell something on Amazon or eBay. We're seeing a lot of that. So I mention that because we are going to talk about talent, right? Talent retention. And so while these side gigs may not impact your particular practice, they are impacting your employees. And so what are you doing to retain your employees in their current state? Because now you have a potential for turnover within your practice. And we all know that turnover within practice is just hard. It's time consuming, and it's something we want to avoid if possible. And so just have the understanding that your office manager may have a side gig that potentially is growing and potentially maybe a predominant source of income for later. So what are you doing to retain that individual? Likewise, talking about fully remote options. Again, less so for your practices, but just something to be aware of in the industry, that fully remote work, and depending on the study, is a huge part of today's economy. Again, depending on the study, we're looking at about 20 to 35% of all jobs, posted jobs, are fully remote. That's a huge deal. And so if you can stay at your house and work for a company on the East Coast, you may have other options, right? Or vice versa. And so just something to be aware for the talent retention standpoint, that there are other options. And so why is your practice going to be the best option for that employee in this current state? Again, we already talked about talent war is real. And so all companies, more than half of all small businesses, which is going to be the bucket that will put a lot of your practices in, will be looking for talent. And then they're talking about 70% of all large employers are planning for benefit enhancements. They're already offering benefits, but what they're having to do is saying, I'm not going to pay you more, but I'm going to enhance your benefits to get you a better benefits package. So it's something to be aware of, that other people in the industry, in your industry, are looking at what are some non-financial ways, non-compensation ways, I should say, to benefit employees. And the easiest trigger to pull, lever to pull, is health benefits. Another trend we're seeing, and I know I'm going through this quick, another trend we're seeing is virtual care. Again, from an implementation standpoint, my assumption is you're not implementing a lot of virtual care visits for your practices, but just for your employee standpoint, virtual care is going to be a big deal. It's quicker, it's easier. When you got 10 o'clock at night, you got a sick kiddo, your employees are likely using virtual care or want the option to use virtual care. And so you can see that respondents, 79% of respondents, it's just more convenient, right? 83% said it's easy to use and we like using it. So people are using virtual care. Having virtual care as a part of your benefits package, that needs to be in the conversation. So make sure you ask the question. If you already have benefits, ask a question to your broker, is virtual care a part of that? And if you're looking for new benefits, make sure that they are included. Talking about price, cost, always an issue every single year. I'm in the industry, and I think costs are outrageous. This year, 8.18% is the number on the screen. That is the number that the Washington State Insurance Commissioner has approved for the individual market. So your employees, if they are currently on an individual plan through the health exchange, are likely going to see an 8.18%, that's an average, to their current plan. Okay, so that's a big deal. I mention this because it's the largest increase by far that we have seen in about 5 years. I go back to about 2017 before we saw an increase like this. And so it's been about 3, 4, 5% every year. This year it's 8.18% is the average. So I mention that because your employees may come to you and say, hey, I got a big old increase this year. What are my options for health benefits through the company? And so just be prepared for that conversation because that's what they're seeing. A lot of reasons for it. But one of the main reasons, specifically for this individual market in the state of Washington, is the cost of COVID is now catching up. Okay, cost of COVID is now catching up. Increased utilization. People are now using their benefits more than ever so before. That's a good thing. But at the end of the day, if people are not using their benefits, the cost is, the hospital systems have not caught up as far as efficiencies yet. So they're trying to work on that. The other reason is pent-up demand for elective surgery. So for about 18 months, people did not get that optional surgery, that optional, doctor's visit. Now they are. If you haven't been to a doctor yet, good luck trying to get in, because it's hard to get into your primary care. It's hard to get into your elective surgeries and your other optional services. So that's another reason. And then the biggest reason that most people don't realize is specifically for individual rates. Those are actually calculated about 6 to 8 months in the background before. And so rates that you're going to be seeing in January 2023 were actually talked about and calculated in 2021. They got approved in kind of early 2022, right? But that's why we're seeing now the COVID wave of costs come through, because the cost of 2020 did not hit until 2022, and really they're not even hitting until 2023. And so that's one thing just to be aware of as we're moving forward, that for this year and next year, my assumption is that for January 2024, we're going to see a similar increase, because now the cost and efficiency models of the hospital systems is now catching up. Okay, so that's another reason for the increase. Never good, but that's the reality that we're living in, at least for this year and probably next year as well. Okay, quick landscape. I didn't want to take too much time on that, but just want to provide some context. And so why is this going to be different? Why, I'm not going to talk about just health insurance for the sake of talking about health insurance. So why are we here today? Mentioned before, we can help one-person companies. Okay, so here's the caveat. First of all, it's going to be Kaiser Permanente. Kaiser Permanente is having this option. They changed their model in January of 2022. And so if you are a single person business owner, not a sole prop, but if you are incorporated as LLC or an S corp, and then here's the trigger: you give yourself a W-2. Let's chat. I can get you group health insurance, which is likely going to be considerably better than what you're going to be seeing on the health exchange, specifically after that 8.18% average increase as well. So that's a big deal. That just happened here in 2022. A lot of people don't know about it, and it's only Kaiser Permanente. And what I do is I steer you towards the PPO options, not their HMO options, but I'll steer towards their Kaiser PPO options, which has a fantastic network. You're not going to have any issues locally, regionally, and even across the country, because they tap in that first choice, first health network. The second thing, and this is why Jeff and I were chatting, we thought it maybe behoove us to chat about linked grouping. So I'll spend a little bit of time here. So again, what we can do is through the association, because you are tied to the Chiropractic Association, we can take multiple groups. So let's just say 10 of you are interested. We'll take all of you 10, and at the same time, we'll kind of move you through the quoting process, and then we'll go to the carriers and we'll say, hey, carriers, and in this case, Premera, Kaiser Permanente, I think we'll say, hey, look at us. It's not just a 2-person practice anymore. It's 5 or 10 2-person, 3-person, 4-person practice. So now you have numbers. Now you have a little bit more leverage. And so what'll happen is we'll go to the carrier, say, hey, look at this bigger group. Yeah, it's multiple entities, but we'll quote you at the same time. You'll get the same preferred rate. You'll kind of get another rate reduction off of that. And then what'll happen is we'll break you apart from an administrative perspective. So you'll get your own billing, you'll get your own employee portal management. And so it's a nice option. It'll look and feel just like you have individual employer insurance, but we'll rate you as a bigger group. Okay, so hopefully that makes sense here. The reason why we can do that is I partner with a few entities, but one I really like is Business Health Trust. You can see their logo in the lower right there. Business Health Trust is a mediary. They go to Premera and Kaiser Permanente and others and say and negotiate better rates and coverage. And so it's called an association health plan is what they're called. And so I can do this linked grouping, and I do it through them is how this works. And so that's why I'm bringing them into the mix to this conversation. Because we're kind of leaning to this direction, I just want to give a little sense of what else they offer. On the medical side, it's Premera and Kaiser. Vision is VSP, and Delta Dental is the dental provider. So from a network standpoint, you're dealing with the best networks that you can get locally here in the state of Washington, regionally, and then even on the national network, tapping into those Blue Cross Blue Shield networks for Premera, and then the First Choice First Health networks nationally for Kaiser. Other things to chat about is employee assistance programs. In this case, Behavioral Health Systems is the provider through BHT, personal accident insurance, life insurances, long-term care insurance. There's other ancillary products that are available. We'll focus just on the medical, dental, vision, but there are other options through BHT, which is another reason I like partnering with them. Another reason I like partnering with Business Health Trust is they really care about their employers and their employees that are members. A couple examples of during COVID, I was able to help and participate with them. Business Health Trust bought, sourced, found PPE and gave it away for free to their employers, their clients. And so millions of masks, tens of thousands of hand sanitizer bottles, thousands of hand sanitizer stations, and just pallets upon pallets of PPE. And it was a requirement of the Washington State. Governor Inslee required, or the health director required to have certain PPE and different things in place. It was hard to come by. And so Business Health Trust was able to source it and then gave it away for free to their employers. So it's a nice, fantastic way to support their businesses. And another thing that Business Health Trust did was create vaccination clinics. So they started, partnered, ran, I think it was about 40 vaccination clinics locally here, regionally. Got some local press out of it, but it's just that it's more than health insurance. They really do lean into different programs and different ways to serve. One thing that Business Health Trust has is free to all employers is an outsourced HR platform. It's through ArchBright. ArchBright's a national company. They're based out of Seattle. But a couple things I like about this free resource that is given with a BHT medical plan is a hotline. It's literally a phone. Pick up the phone, talk to a human about any HR issue, and it's for free. So it's an awesome program that they have through ArchBright. I can talk more about this offline with folks if you're interested, but there's more than just health insurance when we link groups together, which is the main focus. And we'll do that through Business Health Trust with a Kaiser or Premera plan. And then they get access to different optional free additions to include Passport Corporate. If you're not familiar with Passport Corporate, it started out of Microsoft about 30 years ago. So if you have any Microsoft friends, they have a Passport Corporate card. It's like a discount program on steroids. So it's an app on your phone. You download the app. It's all tied to your work email, and it's for free. It's free for every single employee in your practice. They don't have to enroll in medical insurance to be able to have this. And so it's something that Business Health Trust provides as a part of that program. So discounts on retail and restaurants and just different things. And so how I like to promote it when we do open enrollment for groups is, you, the business, have selected a fantastic health plan. And this is a nice perk that is being given to you because of the health plan that your employer is providing you. So it's the way I will promote you, through some of these free resources here. But from a process standpoint, just again, want to reiterate, again, we're talking about linked grouping. So if you are interested in either baselining your current medical plan, because a lot of you are receiving your renewals right now, your January renewals. If you're mid-cycle, we can still do this. We can still quote you. We can still put you as part of the mix. It's not a big deal. You can either come back and circle back to it whenever your mid-cycle renewal is, or you can move over starting, and we'll do it probably January, and kind of move everybody together on a January renewal cycle is how we'll do this. So what we'll do is figure out who all is interested. Okay, we'll need to do that here next, well, whenever technically, but if we want to hit for January, let's try to figure this out next couple of weeks if you're even interested. I will need a census information from you. So simple things, you probably already have it or have submitted it already to your current broker, or it's an easy payroll report to figure out, but it's name, age, gender, date of birth, and zip code is what I'll need. And I'll need some other business information, demographics of your business, like tax ID, address, things like that. I will gather all that information. I will submit quotes as a group individually, but as a group to both Kaiser and Premera, because we'll be going through Business Health Trust. And then we'll link these groups together, and then we'll get one preferential treatment because you're within the BHT construct. You'll get another layer of preferential treatment because you're in the linked group construct. So we're going to have multiple rate reduction options for you as a result of this linked grouping. When the quotes come back, it's going to be, and why we do this is it's going to be the same rate for everybody. Okay, you don't have to pick the same plans. Okay, you don't have to pick every group doesn't have to pick same plans, but you'll get the preferential rates for everybody. So you, business A, can pick, a Premera plan, plan 1, 2, 3, and then another group can pick Premera plan, 4, 5, 6, and then what will happen is we will then break you apart administratively. So that way you'll have your own billing, you'll have your own employee management portal. And so really the only commonality at this point is through that quoting process. You'll get the same rates, and then it looks and feels and smells just like you are an individual employer at that point. And then we'll do it again next year, on renewal time as well. So that will be kind of a one-time, a once a year deal that will collect all the members of the Chiropractic Association, and then we'll link them again on renewal and kind of go from there every year. Nice, fast. I wanted to make sure we touch base. I know you guys are busy. And so about 12:22, I'll pause for questions here. You can do that either verbally or through the chat, but I'm going to stop screen sharing so I can monitor. But what other questions do you have as part of this? Again, this is link grouping. It's something unique. That's fantastic. Or if you're a single individual with the business and you give yourself a W-2, we can help you with this link grouping and also individually. As part of a group insurance policy. So I'll pause here for questions. Read none. Again, I'm Matt Childs with Sapper Insurance, Matt at sapperinsurance.com. Happy to chat either individually or later once you digest. And if you get my information, you always can get it from Jeff as well. But Jeff, I'll turn it over to you.
All right. Well, thank you, Matt. So everybody, the WSCA will continue to work with Matt and Sapper Insurance on this project, and hopefully sometime soon we'll be able to offer something to the membership. If you are interested, please do contact us, and I'll relay that information to Matt. We'll also make sure this recording becomes available for everybody else, and hopefully we'll build up a little bit more steam there. If you do have any questions, feel free to send them to the WSCA at wsca@chirohealth.org. Okay. With that, thank you, Matt, and thank you everybody for logging in, and we'll talk to you soon.